7th question. A 22-year-old female software analyst presents to a medical clinic for evaluation of tingling and numbness in both hands for the past 2 months. Her symptoms are usually aggravated by the end of the workday and absent on most off days. She was diagnosed with type 1 diabetes 2 years ago and is currently taking insulin. She reports being sexually active but has had irregular periods for the past 3 months. A urine pregnancy test result is negative. What is the most likely cause of this patient's symptoms? I will just explain this very quickly. I can totally understand why most of you went with option B, but the answer is actually option A. So, okay, there are certain clues in this question, okay, that point towards a factitious thyrotoxicosis. So, factitious thyrotoxicosis essentially means that the patient is abusing, okay, most likely levothyroxine or, the drug that they give for hypothyroid patients, okay. So, first clue that you need to know, she's working in a nursing home as a staff, okay. First clue. The next one is all the symptoms of hyperthyroidism that she's presenting with. So that's palpitations, chest pain, okay, and what else? Okay, fine. The basic thing, ECG shows absent P waves, points towards an atrial fibrillation, automatically associated with a tachyarrhythmia, okay. In addition to this, like I mentioned, the first clue is the fact that she's working in a nursing home. The second one is that she's trying hard to lose weight. So the first clue's importance is the fact that factitious thyrotoxicosis is most common only in the people who work in healthcare settings, essentially the healthcare professionals, okay, because of easy access to the drug. That's the first thing. Second one is once again abuse most likely by people who want to lose weight, okay. Since hypothyroid patients tend to have weight gain, whereas hyperthyroid tend to lose weight because of the increased BMI, they tend to abuse this drug to sort of lose weight, okay. It's one of the drugs that they abuse, okay, similar to laxative. Once again, people abuse laxatives also to lose weight, but just always keep thyrotoxicosis at the back of your mind, okay, for a young woman especially working in a healthcare setting and wanting to lose weight, okay. So all of this just points towards thyrotoxicosis, and factitious thyrotoxicosis, and like I mentioned, the other features of hyperthyroidism just kind of confirm it, okay. Now, anorexia nervosa can present very, very similar to this, especially with the tachyarrhythmia, okay, the wanting to lose weight, the palpitations, okay, and all of that. But it says all other physical findings are normal. Now, in the case of anorexia, all other physical findings would not be normal. Moreover, it says she appears well nourished. As you know, anorexia nervosa, the patients usually have a BMI of less than 18.5 kg per meter square. They will not appear well nourished, okay. Moreover, the other physical findings, there are a lot of them, but some important things that you can think of is lanugo hair. You'll definitely be able to observe that on the patient's on the patient's body. In addition to that, you can have parotid hypertrophy, okay. If they also have purging behavior, as in they throw up a lot, you can see dental caries, okay, due to the constant hydrochloric acid coming and corroding their enamel. So these features kind of point towards this. Since she does not have any of the other features, you can just rule out anorexia as a cause, okay. Hashimoto's thyroiditis, unlikely, since in this case she's presenting with hyperthyroid symptoms, whereas Hashimoto's presents with hypothyroid symptoms. And though in Hashimoto's you do have an initial phase of hyper and then followed by hypo, it's like too specific and too short a time period to actually go into that, so you can just rule that option out. Toxic nodule or goiter is okay, especially if it's a functional nodule, okay, can present with hyperthyroidism, but in this case they should actually present with a nodule in the neck. Nothing of that has been mentioned, rule it out. Graves' disease, yes, it's a cause of hyperthyroidism, okay, but other features that are more specific for that are your thyroid ophthalmopathy, so your lid retraction, your lid lag, and then your proptosis. All this points towards, and it's more specific, okay. This is sort of very generalized, and like I mentioned, those 3 clues just points towards abuse of thyroid drugs.
Thanks for watching. Please give a thumbs up and subscribe for more.